Peripheral limiting tissues are recorded in function by manipulation of tongue, cheeks, lips, and mandibular movements with a suitable impression material. Denture retention and stability are in part contingent upon intimate adaptation of the denture base to the soft tissue. These factors can be maximized by careful border molding procedures. There are other materials and methods for achieving a registration of functional border movements. We will apply the green stick compound in segments, with manipulation of the tissues while the material is in a pliable state. Areas where there are rough spots can be refined with a Hanau torch. Be sure to temper the material in a water bath. The border molding is essentially a vehicle by which impression material is delivered to the appropriate area. The actual registration of functional tissue is with the impression material. Custom trays must be checked intraorally. Occasionally, the border molding material must be removed and the tray reduced accordingly. Insert the tray. Ask the patient to open and close and protrude the tongue. Cheeks should be manipulated. Usually a space about the width of a mirror handle should exist between the movable tissue and the tray. The mandibular tray should cover the retromolar pad. The maxillary tray should extend past the vibrating line and into the hamular notch. Identify the landmarks in the impression associated with the arch. The distobuccal aspect is border molded by asking the patient to open and close, and move the jaw side to side. The custom tray should not interfere with this movement. Border molding is usually done bilaterally. The buccal labial vestibule is border molded. Ask the patient to suck down as if using a straw. Gently pull the cheek to register the buccal frenum. To record the labial vestibule, gently pull the lip out and down. Ask the patient to suck down as if using a straw. Gently pull the lips to register the labial frenum. Border molding the posterior area and the coronoid process are critical components in achieving retention of the upper denture. In most cases, the tray should exhibit a peripheral seal, exhibited by distinct suction on removal. To record the mesenteric notch area, ask the patient to open and close. Next, the retromylohyoid curtain area. Push the tongue against the tray handle and then close. The mylohyoid area and the sublingual fold. The patient licks their lips with the tip of the tongue. The tongue is placed alternately in the right and left cheek. The labial flange. Raise and lower the lip. Elevate the frenum manually. The buccal flange area. Massage the cheek. Gently pull the cheek forward and backward. Chill the border molding. Trim the inner and outer aspect as well as the top of the border molding with a sharp knife. Trim about 1/2 to 1 millimeter to allow room for impression material.